Official medical archives document a tragic tale of megalomania and unchecked surgical horror, revealing an anatomy of malpractice where fabricated success hit a 30% mortality rate. In the early 20th century, Trenton Psychiatric Hospital was a beacon of modern hope. Behind its imposing brick walls, a charismatic medical director promised a revolutionary, permanent cure for the incurable human mind. His name was Dr. Henry Cotton. While traditional psychiatrists relied on futile talk therapy and straitjackets, Cotton brought a terrifyingly physical approach to madness. He wanted to surgically cut it out. Cotton championed the focal infection theory. He firmly believed that schizophrenia and manic depression were purely biological. He theorized that hidden, localized infections were producing fatal toxins, slowly poisoning the brain. To Dr. Cotton, the solution to insanity was horrifyingly simple and mechanical. If the body harbored a toxic infection, that tissue had to be aggressively removed. The operating room replaced the asylum. The surgical crusade began with the most accessible biological targets: the human mouth. Convinced the roots of madness hid in dental cavities, Cotton established an eradication protocol that was brutally swift. Vulnerable patients, entirely without consent, were dragged into his clinical chair. Cotton didn't just pull isolated infected teeth, he extracted them all. Psychiatric patients routinely left his office completely toothless. When removing teeth failed to cure severe auditory hallucinations, Cotton's scalpel moved deeper. He ruthlessly excised tonsils and brutally scraped sinus cavities down to the bone. Yet, the psychosis remained untouched. A rational medical mind would have questioned this failing theory. But Dr. Cotton was possessed by clinical megalomania. If the infection wasn't hiding in the head, it must be breeding in the abdomen. The methodology escalated into pure anatomical violation. Cotton convinced himself that the stomach and intestines were the true breeding grounds for the microscopic toxins destroying his patients' fragile minds. Major abdominal surgery in the 1920s was incredibly dangerous. Yet Cotton aggressively performed highly invasive laparotomies on psychiatric patients, excising portions of stomachs and spleens based on nothing but pure delusion. His ultimate obsession became the colon. Cotton claimed chronic constipation caused decaying food to breed specific bacteria, sending a constant, invisible stream of psychological poison directly to the patient's brain. His definitive cure was the total colectomy. He literally amputated massive, healthy sections of the large intestine, severing vital organs of non-consenting people to rid them of non-existent biological demons. Trenton Psychiatric Hospital began to look like a grotesque biological butcher shop. Cotton proudly displayed jars of severed intestines, presenting them to the world as the physical manifestation of insanity. Despite the butcher-like nature of his daily work, Cotton was celebrated globally. Publishing extensive papers in prestigious medical journals, he proudly claimed his extreme methodology achieved an 85% cure rate. The mainstream press hailed him as a brilliant medical pioneer. Desperate families begged him to operate on their loved ones. But the flawless clinical statistics he presented were a meticulously constructed lie. The celebrated 85% cure rate was a systemic fabrication. The grim reality was that the hospital's private graveyard was expanding at a terrifying pace. The operating table was a death sentence. The unprecedented volume of complex abdominal surgeries eventually raised alarms. Dr. Adolf Meyer, a leading psychiatrist, noticed glaring anomalies. Cotton's data simply didn't align with the harsh biological reality of colon surgery. In 1924, Mayer dispatched a brilliant young doctor, Phyllis Greenacre, to conduct a covert clinical audit of Trenton Hospital. She was sent behind enemy lines to dissect the famous surgeon's data. Dr. Greenacre descended into the hospital's chaotic archives. Bypassing Cotton's polished reports, she went directly to the raw, original patient files. What she uncovered was a staggering, bloody medical cover-up. Cotton was deliberately manipulating mortality statistics. When a patient bled to death on the table or died of severe peritonitis, he never recorded it as a surgical complication. He erased his fatal mistakes. Instead, he falsified official death certificates. He legally documented their agonizing deaths as the inevitable biological result of terminal psychosis. He blamed the madness, systematically protecting the reputation of his scalpel. Greenacre's audit revealed the chilling truth. For patients forced to undergo total colectomies, the actual mortality rate sat between 30 and 45%. It wasn't medical treatment, it was an institutional massacre. And the patients Cotton claimed were cured. Greenacre found them. Many were permanently mutilated, completely incapacitated, and suffering from severe chronic abdominal pain, lingering in the dark wards like living ghosts. Greenacre delivered her devastating autopsy of Cotton's brutal methods. But in a horrifying twist of institutional cowardice, the medical establishment buried her report. They feared a public scandal more than they cared for patients. With the audit officially suppressed, Dr. Cotton's ego mutated into an unstoppable God complex. Continuing his abdominal amputations for another decade, Trenton Hospital remained his personal, highly lethal surgical laboratory. His belief in the focal infection theory was so absolute, it infected his own home. To prevent them from ever going insane, Cotton forced his two sons into preventative dental and colon surgeries. The ultimate tragedy of his arrogance was absolute. Both sons, permanently damaged physically and psychologically by their father's preventive surgeries, later committed suicide. The brilliant surgeon had systematically destroyed his own bloodline. In 1933, the biological clock stopped for the infamous surgeon. Dr. Henry Cotton died of a sudden, massive heart attack, taking his last breath, convinced he was a savior of modern medicine. He left behind a truly horrific legacy. Thousands of vulnerable patients had been brutally mutilated, their healthy organs harvested in a futile war against a phantom infection. His blood-stained operating room permanently closed. Modern psychiatry eventually proved that schizophrenia is a deeply complex neurological condition. It absolutely cannot be extracted with dental forceps, nor can it be cured by brutally severing the human intestine. The Henry Cotton era remains a permanent, bloody stain on the history of psychiatry. It is the ultimate clinical example of what happens when a doctor's massive ego eclipses harsh biological evidence. But the true monster wasn't just Dr. Cotton alone. It was the entire medical establishment that watched him massacre his patients, actively choosing to look the other way to protect their institutional prestige. The final forensic diagnosis for Dr. Henry Cotton is not that of a misunderstood pioneer. History and modern pathology have accurately diagnosed him as a highly efficient, legally protected, institutional butcher. The asylum stands today as a chilling historical monument. It serves as a dark reminder that sometimes the most dangerous place for a vulnerable mind is strapped down on a sane surgeon's operating table. The focal infection theory has been thoroughly debunked. The physical evidence of his atrocities quietly buried. But the terrifying anatomy of this surgical nightmare is now permanently documented inside the Blackbook. Countless clinical anomalies are still waiting in the dark to be placed on our autopsy table. What exactly happens when the cure is far more lethal than the disease? Until the next file, trust no diagnosis.